Imagine waking up one morning during pregnancy and noticing a small amount of blood. Your heart starts racing. Is this normal? Should you call your doctor? Could something be wrong with your baby? For many women, these questions are frightening. Pregnancy is a time filled with excitement, hope, and anticipation, but it can also bring uncertainty. While many pregnancies progress without major complications, it's important to understand that certain symptoms should never be ignored. One of the most difficult experiences an expectant family can face is miscarriage. Although it's more common than many people realize, it's also a topic that isn't discussed enough. Because of this, many women don't know which symptoms are normal and which require immediate medical attention. In today's video, we'll discuss the most important warning signs of miscarriage every woman should know. We'll explain which symptoms require urgent medical evaluation, which symptoms can sometimes be completely normal, what increases the risk of miscarriage, and when it's essential to seek emergency medical care. Our goal isn't to frighten you. Instead, it's to help you recognize warning signs early so you can make informed decisions and receive medical care as quickly as possible if needed. Before we begin, remember that this video is for educational purposes only and should never replace advice from your healthcare provider. If you're pregnant and experience concerning symptoms, always contact your doctor or visit the nearest emergency department. Now, let's begin by understanding exactly what a miscarriage is. A miscarriage, also known as spontaneous pregnancy loss, occurs when a pregnancy ends naturally before the baby is able to survive outside the womb. Most miscarriages happen during the first trimester, which is the first 13 weeks of pregnancy. In fact, the majority occur before the 12th week. Many people are surprised to learn that miscarriage is relatively common. Experts estimate that around 1 in every 10 known pregnancies ends in miscarriage. The actual number may be even higher because some pregnancy losses occur before a woman even realizes she's pregnant. Although miscarriage is common, that doesn't make it emotionally easier. Every pregnancy represents hopes, dreams, and plans for the future. Losing a pregnancy can be devastating for both parents. One important fact to understand is that most miscarriages are not caused by anything the mother did. Everyday activities like walking, working, exercising normally, or lifting light objects rarely cause miscarriage. In many cases, early pregnancy loss happens because the developing embryo has chromosomal abnormalities that prevent normal growth. This is nature's way of stopping a pregnancy that could not have developed normally. Understanding this can help relieve unnecessary guilt that many women experience after pregnancy loss. Now let's look at the symptoms that should never be ignored. The most common warning sign associated with miscarriage is vaginal bleeding. However, this is also one of the most misunderstood symptoms because not every episode of bleeding means a miscarriage is occurring. Some women experience light spotting during early pregnancy, especially around the time the fertilized egg implants into the uterus. Implantation bleeding is usually very light, lasts only a short time, and often appears pink or brown rather than bright red. On the other hand, bleeding that becomes heavier, bright red, contains clots, or continues to increase should always be evaluated by a healthcare professional. Heavy bleeding that soaks through one sanitary pad every hour is especially concerning. Some women notice only a few drops of blood, while others experience bleeding similar to or heavier than a menstrual period. The amount of bleeding alone doesn't always determine how serious the situation is. Some pregnancies continue normally despite early bleeding, while others unfortunately do not. This is why it's impossible to diagnose a miscarriage based only on bleeding. Doctors often perform an ultrasound and blood tests to determine whether the pregnancy is developing normally. If you notice any bleeding during pregnancy, even if it's only a small amount, contact your healthcare provider for guidance. Never assume it's normal without speaking to a medical professional. Many women experience mild cramping during early pregnancy. As the uterus expands and the ligaments stretch, brief episodes of discomfort can be completely normal. However, severe or persistent abdominal pain is different. Pain associated with miscarriage is often stronger than ordinary menstrual cramps. Some women describe it as intense waves of cramping that become increasingly painful over time. The pain may be located in the lower abdomen, pelvis, or lower back. Cramping accompanied by heavy bleeding deserves immediate medical attention. It's also important to remember that severe one-sided pelvic pain can sometimes indicate an ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in a fallopian tube. This condition can become life-threatening if not treated promptly. Symptoms may include severe pelvic pain, shoulder pain, dizziness, fainting, and vaginal bleeding. If you experience these symptoms, seek emergency medical care immediately. Warning sign number 3. Passing blood clots or tissue. One of the clearest warning signs of miscarriage is passing blood clots or grayish tissue through the vagina. During pregnancy loss, the uterus begins emptying its contents. Women may notice clumps of tissue mixed with blood. Sometimes the tissue appears gray, white, or pink rather than bright red. Passing tissue should never be ignored. If this happens, contact your healthcare provider or go to the emergency department as soon as possible. In some situations, healthcare providers may ask you to save the passed tissue if possible, because laboratory examination can sometimes help determine the cause of the pregnancy loss. Although this may feel emotionally overwhelming, it can provide valuable medical information, particularly for women who experience repeated miscarriages. Even after tissue has passed, medical evaluation remains important. Doctors need to confirm that the uterus has emptied completely and ensure that heavy bleeding or infection does not develop afterward. So far, we've discussed 3 of the most important warning signs: vaginal bleeding, severe cramping, and passing blood clots or tissue. But miscarriage doesn't always begin with these symptoms. In some cases, the warning signs are much more subtle and can easily be mistaken for normal pregnancy changes. Warning sign number 4. A sudden loss of pregnancy symptoms. One symptom that many women find confusing is the sudden disappearance of pregnancy symptoms. During the first trimester, it's common to experience nausea, vomiting, breast tenderness, fatigue, food aversions, or a heightened sense of smell. These symptoms are largely driven by pregnancy hormones, especially human chorionic gonadotropin, or HCG. As pregnancy progresses, many of these symptoms naturally improve. For example, morning sickness often begins to ease around the end of the first trimester. This is a normal part of pregnancy for many women. However, a sudden and complete loss of pregnancy symptoms, particularly when combined with vaginal bleeding or cramping, may be a warning sign that should not be ignored. Some women who experience a missed miscarriage notice that they no longer feel pregnant. Their nausea disappears overnight, their breasts become less tender, and their energy suddenly returns. Although these changes don't always mean a miscarriage has occurred, they should be discussed with a healthcare provider. It's important to remember that every pregnancy is different. Some women have very few symptoms throughout pregnancy and go on to deliver healthy babies. That's why symptoms alone cannot determine whether a pregnancy is healthy. Only an ultrasound examination and appropriate medical evaluation can provide accurate answers. If you're ever uncertain, it's always better to seek medical advice than to spend days worrying. Warning sign number 5. Persistent lower back pain. Back pain is another symptom that many pregnant women experience. As your baby grows, your center of gravity changes, your posture adjusts, and pregnancy hormones loosen the ligaments supporting your pelvis. These changes often cause mild discomfort in the lower back. But miscarriage-related back pain is often different. Women frequently describe it as a constant, deep ache or intense cramping that doesn't improve with rest. Sometimes the pain comes in waves, similar to labor contractions. The discomfort may spread across the lower back and pelvis and can become progressively stronger over time. When severe lower back pain occurs together with vaginal bleeding, abdominal cramps, or the passing of tissue, medical evaluation should not be delayed. Persistent back pain accompanied by fever may also suggest an infection, which requires prompt treatment to protect both the mother and the pregnancy. Remember, back pain by itself is very common during pregnancy. It's the combination of back pain with other concerning symptoms that makes immediate medical evaluation especially important. Warning sign number 6. Fever, chills, or signs of infection. A healthy pregnancy should not cause a high fever. If you develop a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, especially together with chills, severe pelvic pain, or foul-smelling vaginal discharge, seek medical attention immediately. These symptoms may indicate an infection affecting the uterus or pregnancy tissues. Although infections are not among the most common causes of miscarriage, certain bacterial and viral infections can increase the risk of pregnancy complications. After a miscarriage has begun, retained pregnancy tissue inside the uterus can also become infected if it isn't completely removed. Signs of a possible uterine infection include fever chills increasing pelvic pain, heavy bleeding, foul-smelling vaginal discharge, feeling weak or generally unwell. Untreated infections can become serious and may spread into the bloodstream. Fortunately, prompt treatment with antibiotics and appropriate medical care is highly effective in many cases. Never ignore fever during pregnancy. Even if it turns out not to be related to miscarriage, your healthcare provider will want to determine the cause and recommend the safest treatment for both you and your baby. Warning sign number 7, fluid leaking from the vagina. Another symptom that requires prompt evaluation is leaking fluid. Many women notice increased vaginal discharge during pregnancy, and this is usually completely normal. Healthy pregnancy discharge is often thin, white, or clear, and has very little odor. However, a sudden gush of clear fluid or continuous leaking that soaks your underwear may indicate that the amniotic sac has ruptured. The amniotic sac surrounds your baby and contains the fluid that cushions and protects normal development. If this sac breaks too early, especially before the baby is able to survive outside the womb, it can lead to serious pregnancy complications. Leaking fluid may feel similar to accidentally urinating, which can sometimes make it difficult to recognize. If you're unsure whether you're leaking urine, normal discharge, or amniotic fluid, don't try to diagnose it yourself. Your healthcare provider can perform a simple examination and specialized tests to determine the source of the fluid. Prompt evaluation is especially important because ruptured membranes increase the risk of infection. In later pregnancy, fluid leakage should always be assessed as quickly as possible. Understanding missed miscarriage. Not every miscarriage causes heavy bleeding or severe pain. Some women experience what's known as a missed miscarriage. In this situation, the embryo or fetus has stopped developing, but the pregnancy tissue remains inside the uterus. Because the body has not yet recognized the loss, there may be little or no bleeding. Many women continue to feel pregnant for days or even weeks. A missed miscarriage is often discovered unexpectedly during a routine prenatal ultrasound when no heartbeat is detected or the baby's growth has stopped. Learning this news during what was expected to be a joyful appointment can be emotionally devastating. It's important to remember that a missed miscarriage is usually not caused by anything the mother did or failed to do. Most early pregnancy losses occur because of chromosomal abnormalities that prevent normal fetal development. Knowing this cannot erase the grief, but it can help relieve the unnecessary guilt that many families experience. What happens after you contact your doctor? If you report symptoms such as bleeding, severe cramping, fluid leakage, or passing tissue, your healthcare provider will likely recommend an evaluation. Depending on your symptoms and the stage of pregnancy, this may include a detailed discussion of your symptoms and medical history, a physical or pelvic examination, an ultrasound to check the baby's development and heartbeat, blood tests to measure pregnancy hormone levels, especially HCG, additional blood tests to check your blood type, look for signs of infection, or evaluate blood loss if heavy bleeding has occurred. These tests help determine whether the pregnancy is progressing normally or whether treatment is needed. Remember, bleeding does not always mean a miscarriage has occurred. Many women experience early pregnancy bleeding and continue to have completely healthy pregnancies. That is why proper medical evaluation is so important. Warning sign number 8, severe dizziness, fainting, or weakness. Let's talk about another symptom that should never be ignored during pregnancy, severe dizziness or fainting. Feeling slightly lightheaded once in a while can be normal, especially when standing up quickly. During pregnancy, your blood vessels relax, your blood pressure may temporarily decrease, and your body is working harder to support your growing baby. However, severe dizziness, repeated fainting, or feeling like you're about to lose consciousness is different. These symptoms may indicate significant blood loss from heavy bleeding, dangerously low blood pressure, dehydration, or, in some cases, an ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in a fallopian tube. As the pregnancy grows, it can cause the tube to rupture, leading to life-threatening internal bleeding. Signs of an ectopic pregnancy may include severe one-sided abdominal pain, vaginal bleeding, shoulder pain, dizziness, fainting, weakness, rapid heartbeat. If you experience these symptoms, do not wait to see if they improve. Call emergency medical services or go to the nearest emergency department immediately. Prompt treatment can save your life. Warning sign number 9, decreased or absent baby movement. This warning sign applies later in pregnancy. Most mothers begin feeling fetal movements somewhere between 16 and 25 weeks, although the exact timing varies from one pregnancy to another. As your baby grows, you'll gradually become familiar with your baby's normal movement pattern. Some babies are more active during the evening, while others move frequently after meals. What matters most is recognizing your baby's usual routine. If you notice that your baby is moving much less than normal or stops moving altogether, don't ignore it. Sometimes babies simply have quiet periods, but a significant decrease in movement can also indicate that the baby needs immediate medical evaluation. Many healthcare providers recommend performing kick counts. Although recommendations may vary, a common approach is to choose a time when your baby is usually active and count how long it takes to feel 10 movements. If movements are noticeably reduced or you cannot feel your baby moving despite eating, drinking water, or resting on your side, contact your healthcare provider immediately. Never hesitate because you think you might be overreacting. Healthcare professionals would much rather examine a healthy baby than miss an opportunity to identify a serious problem early. Warning sign number 10, heavy bleeding with severe pain. The final warning sign is a combination of symptoms rather than a single symptom. Heavy vaginal bleeding together with severe abdominal pain, intense cramping, fever, dizziness, or passing tissue requires immediate medical attention. These symptoms can indicate an ongoing miscarriage, an ectopic pregnancy, placental complications, serious infection, heavy blood loss. If you're soaking through a sanitary pad every hour, passing large clots, or experiencing severe pain that continues to worsen, don't drive yourself if you feel weak. Ask someone to take you to the hospital or call emergency medical services. Quick medical care can help protect your health and may even improve pregnancy outcomes in certain situations. Who is at higher risk of miscarriage? Although miscarriage can happen in any pregnancy, certain factors increase the likelihood. One of the strongest risk factors is maternal age. As women get older, especially after age 35, the risk of chromosomal abnormalities gradually increases. Previous miscarriage is another important factor. Having one miscarriage does not necessarily mean future pregnancies will end the same way. In fact, many women who experience one miscarriage go on to have completely healthy pregnancies. However, recurrent pregnancy loss, typically defined as 2 or more consecutive miscarriages, may require further medical evaluation. Other risk factors include uncontrolled diabetes, thyroid disorders, certain autoimmune diseases, uterine abnormalities, hormonal disorders, obesity, smoking, heavy alcohol consumption, recreational drug use. Certain infections, exposure to harmful environmental chemicals may also increase pregnancy risks. However, it's important to remember something reassuring. Many women who have one or more of these risk factors still deliver healthy babies. Risk factors increase probability. They do not guarantee pregnancy loss. Can miscarriage be prevented? This is one of the most common questions doctors hear. The answer depends on the underlying cause. Unfortunately, many early miscarriages result from chromosomal abnormalities that cannot be prevented. Nothing the mother ate, drank, or did cause these genetic changes. However, there are important steps that support a healthy pregnancy. These include: begin prenatal care as early as possible. Take prenatal vitamins containing folic acid before pregnancy if possible and throughout early pregnancy. Keep chronic medical conditions such as diabetes and high blood pressure under good control. Avoid smoking, alcohol, and recreational drugs. Maintain a balanced diet rich in fruits, vegetables, lean proteins, whole grains, and healthy fats. Stay physically active with exercises approved by your healthcare provider. Attend all scheduled prenatal appointments. Get enough sleep and manage stress in healthy ways. If you're taking prescription medications, never stop them on your own. Instead, ask your doctor whether they're safe during pregnancy. Some medicines may need adjustment before or during pregnancy. Common myths about miscarriage. Let's clear up a few common misconceptions. Myth number 1, exercise causes miscarriage. For most healthy pregnancies, moderate exercise recommended by a healthcare provider is safe and beneficial. Walking, swimming, prenatal yoga, and other low-impact activities often improve overall health during pregnancy. Myth number 2, stress always causes miscarriage. Everyday emotional stress has not been shown to directly cause most miscarriages. Although managing stress is important for overall health, women should never blame themselves because they experienced a stressful period before pregnancy loss. Myth number 3, one miscarriage means you'll never have a healthy baby. This is simply not true. Many women who experience miscarriage later go on to have successful pregnancies. One miscarriage does not usually predict future pregnancy loss. Taking care of your emotional health miscarriage is not only a physical event, it is also an emotional loss. Many women experience grief, sadness, anger, anxiety, or guilt. Partners and family members often experience these emotions as well. Remember this. Most miscarriages happen because the pregnancy could not develop normally, not because of something the parents did. If you experience pregnancy loss, allow yourself time to grieve. Talk openly with your partner, your healthcare provider, trusted family members, or a professional counselor. Seeking emotional support is a sign of strength, not weakness. Healing takes time, and every family's journey is different. How do doctors diagnose a miscarriage? If you experience symptoms such as vaginal bleeding, severe cramping, passing tissue, or fluid leakage, your healthcare provider will perform several tests to determine what's happening. The first step is usually discussing your symptoms in detail. Your doctor may ask questions like, when did the bleeding start? How much bleeding are you experiencing? Are you passing clots or tissue? Are you having pain? Have your pregnancy symptoms changed? How many weeks pregnant are you? Next comes a physical examination. This may include checking your blood pressure, heart rate, temperature, and performing a pelvic examination to determine whether the cervix has started opening. An open cervix together with bleeding may indicate that a miscarriage is in progress. However, every situation is different, which is why additional testing is usually necessary. Ultrasound, the most important test. One of the most valuable tools for evaluating early pregnancy is ultrasound. Depending on how far along the pregnancy is, your healthcare provider may perform either an abdominal ultrasound or a transvaginal ultrasound. A transvaginal ultrasound uses a small probe placed inside the vagina to provide clearer images during early pregnancy. Many women worry that this examination could harm the pregnancy. Fortunately, it is considered safe and does not increase the risk of miscarriage. During the scan, the healthcare provider checks several important things. They look for the location of the pregnancy, the size of the embryo or fetus, whether a heartbeat is present, whether the pregnancy is developing appropriately for the gestational age, signs of bleeding around the pregnancy, evidence of an ectopic pregnancy. Sometimes everything appears completely normal despite early bleeding. This is called a threatened miscarriage. In many cases, these pregnancies continue successfully. Other times, the ultrasound may unfortunately show that the pregnancy has stopped developing. Although this is heartbreaking news, ultrasound helps doctors determine the safest next steps. Blood test doctors often order blood tests alongside the ultrasound. One important blood test measures the pregnancy hormone called human chorionic gonadotropin, or HCG. During early pregnancy, HCG levels usually rise rapidly. Your healthcare provider may repeat this blood test over several days to see whether hormone levels are increasing as expected. Another important test checks your blood type. Women with raw negative blood may require an injection called raw immune globulin after certain pregnancy complications. This medication helps protect future pregnancies by preventing your immune system from developing antibodies against raw positive blood. Additional blood tests may be ordered to evaluate blood loss, look for signs of infection, assess overall health, identify possible contributing medical conditions. Treatment options after a miscarriage. If a miscarriage is confirmed, treatment depends on the stage of pregnancy, the amount of bleeding, your symptoms, and your overall health. There are generally 3 possible approaches. Option 1, expectant management. Sometimes the body naturally completes the miscarriage without medical treatment. This approach is called expectant management. Your healthcare provider carefully monitors your symptoms while allowing your body time to pass the pregnancy tissue naturally. For some women, this happens within days. For others, it may take several weeks. During this time, your doctor will explain what symptoms to expect and when you should seek immediate medical attention. Option 2. Medication. In some cases, medication may be recommended to help the uterus empty more completely. These medicines cause the uterus to contract, helping pregnancy tissue pass naturally. Your healthcare provider will explain how to take the medication, what symptoms to expect, how much bleeding is considered normal, when to return for follow-up care. Many women experience cramping and heavy bleeding while the medication is working. Your healthcare team will explain how to manage discomfort safely. Option 3. Surgical treatment. Sometimes a minor surgical procedure is recommended. This is often called dilation and curettage, or D&C, although the exact procedure may vary depending on the situation. Surgery may be recommended if heavy bleeding continues, infection develops, pregnancy tissue remains inside the uterus. The woman prefers surgical management. Emergency treatment becomes necessary. The procedure is usually completed within a short period, and most women recover well. Your healthcare provider will explain the risks, benefits, and recovery process before treatment. Physical recovery after miscarriage is different for every woman. Many women experience bleeding similar to a menstrual period for several days or even a few weeks. Mild cramping is also common. Your healthcare provider may recommend avoiding tampons, swimming, or sexual intercourse for a short period while the uterus heals. Follow-up appointments are important to ensure the miscarriage has completed and that no complications have developed. Most women recover physically within several weeks. Emotional healing, however, often takes much longer. When should you go to the emergency room? Some symptoms require immediate emergency medical care. Do not wait until the next day if you experience heavy bleeding that soaks through one sanitary pad every hour for 2 consecutive hours, severe abdominal or pelvic pain, fainting or loss of consciousness, difficulty breathing, chest pain, severe dizziness, high fever with chills, foul-smelling vaginal discharge, severe one-sided pelvic pain, shoulder pain together with abdominal pain, sudden weakness or confusion. These symptoms may indicate heavy blood loss, infection, an ectopic pregnancy, or another medical emergency. Early treatment can be life-saving. Can you have a healthy pregnancy after a miscarriage? One of the biggest fears many women have after miscarriage is whether they will ever become pregnant again. The encouraging news is that the answer is often yes. Most women who experience one miscarriage go on to have healthy pregnancies. Even after 2 miscarriages, many couples eventually welcome healthy babies. If you've experienced recurrent pregnancy loss, your healthcare provider may recommend additional testing to look for possible underlying causes. Modern medicine has identified many conditions that can be treated successfully, improving the chances of future healthy pregnancies. Never lose hope after a single miscarriage. Every pregnancy is unique. Final Thoughts Pregnancy is one of life's most extraordinary journeys. While most pregnancies progress normally, understanding the warning signs of miscarriage can help you seek medical care when it matters most. Remember these important messages. Vaginal bleeding should always be reported to your healthcare provider. Severe cramping, passing tissue, fever, leaking fluid, severe dizziness, or reduced baby movement later in pregnancy should never be ignored. Many symptoms that seem frightening can actually have harmless explanations. Likewise, some serious conditions may begin with only mild symptoms. That is why professional medical evaluation is always the safest choice. Perhaps the most important message of all is this: if you experience a miscarriage, it is almost never your fault. Most early pregnancy losses occur because of chromosomal abnormalities that cannot be prevented. Blaming yourself only adds unnecessary pain during an already difficult time. If you are pregnant, attend all prenatal appointments, follow your healthcare provider's advice, maintain a healthy lifestyle, and never hesitate to seek medical care whenever something doesn't feel right. Listening to your body could make all the difference.